Urinary tract infections are the most common bacterial infections in women, with one half of all women experiencing at least one UTI in their lifetime. Although acute uncomplicated cystitis may not be thought of as a serious condition, patients' quality of life is often significantly affected. Most urinary tract infections are acute uncomplicated cystitis. While the diagnosis is uncomplicated, this does not mean that it's always easy to properly evaluate and treat those suffering from simple bladder infections. Hello, my name is Richard Colgan. I'm professor and executive vice chair of family and community medicine at the University of Maryland School of Medicine. At this year's FMX Satellite Symposium on UTIs, we'll look at some of the challenges the clinician faces when treating those with lower urinary tract symptoms, or LUTs. We'll review the signs, symptoms, and laboratory findings in acute uncomplicated cystitis, while emphasizing the questions that come up for all of us along the way. We'll review the clinical diagnosis of UTIs, as well as the burden which these seemingly minor infections can have on the quality of life of women who suffer from them. Is this a UTI? Is it simple or complicated? What makes it complicated? What are the risk factors for antimicrobial resistance? Why should I care? These are some of the questions we'll look to address at the symposium. We have a panel of experts in this area to include Dr. Lillian Abos, professor of infectious disease at the University of Miami Miller School of Medicine, who will focus on emerging therapies. The guidelines recommend 3 options for first-line treatment of acute uncomplicated cystitis. Can you name all 3? Dr. Lily Lee, Chief of Emergency Medicine at Jackson Memorial Hospital and affiliated assistant professor of surgery at the Miller School of Medicine, will be joining us. Dr. Lee will focus on the challenges of uncomplicated UTI management in the acute care setting and disparities that create barriers to care. Should we treat asymptomatic women who are found to have positive leukocyte esterase on their UA? Should a urine culture be sent? Should this be equal from the office setting as well as from the emergency room? We as busy clinicians know that acute uncomplicated cystitis is a common ailment for which women seek our help. We also know that there are still many questions to be answered as we look to take the best care of our patient while safeguarding the patient and our community from the present threat and danger of antimicrobial resistance. We look forward to your attendance at this satellite meeting held at the Marriott Marquis Hotel in Chicago this October 28th at 6 p.m. to discuss urinary tract infections and learn how we may take even better care of our patients. Thank you very much.